Hey, welcome back. We got help from head to toe. How about that? Elliot Cleveland is with us from Limitless Therapy to help us talk about those nagging knee, hip, and ankle pains. I can't imagine that, Elliot. You're too young to have those pains.
What about you, Jeff?
Exactly.
Yeah, I'm here to help.
What about both of us, right? And that's the thing. There's no age associated with like these issues that people have. Dr. Cleveland, talk to us about some of the things that you have folks coming in to you with. What types of injuries and concerns are they coming to you with?
Yeah, we treat active adults and athletes all across the upstate. It's a lot of knee pain, a lot of hip pain, and a lot of ankle pain. One of my mentors when I practiced down in Charleston always said the knee is the innocent middleman though.
Yeah.
Usually it's not a knee problem unless we're talking about arthritis or some sort of trauma that happened to the knee. But I see a lot of knee pain patients. And that's usually because they don't have supportive shoe wear from the ground up.
Really?
Or they have hip weakness that from the top down is causing a change in the knee mechanics.
So the knee is just the way that it manifests itself.
Bingo.
That's really cool.
So some of that can be weight related, I think, too. It's odd. I can carry groceries in and walk up my 5 steps. My knees hurt. If I put it back down and walk up the steps again, the knees don't hurt.
Yeah.
Right.
So weight has to do something.
And it's a lot related to load, meaning how much are you trying to do at one time.
Okay.
And if you haven't accommodated to that, whether that's with resistance training or working out, and you try a big load like, we get our egos involved when we try to get groceries out of the car and take as many bags as possible. That's a new load that your body's not ready for.
Right.
So we either need to help you strengthen your core and your lower extremities, or we need to do something to put some extra support in your shoe. And that's where things like orthotics come into play, or getting really high-end shoes. So one of the things we do is supply people with custom orthotics.
So that's what you do. A lot of your business is that.
Yeah, so we do a lot of physical therapy treatment, and then some of the things, if somebody's strong and it's really truly not a strength or mobility problem, the next step is, can we supply them with a custom orthotic that's made specifically for not just how their foot looks, but how their foot moves when it hits the ground.
Yeah, let's talk about orthotics and what is that process like? Is it a consultation to kind of look and see where the issues are, and then you're able to make those for a lot of different types of lifestyles?
Yes. So it used to be, I would make these in the clinic. I'd have to take multiple materials, watch you walk, and then make a guess at what's going on.
Yeah.
And then I'd have to heat these materials up and melt them together. Thankfully, technology has improved.
And they've gotten better as far as attractiveness, right?
Yes.
They're looking better. Those kind of shoes.
So now we have people walk, jump, and run across a force plate. And this gives us, to the degree, how every bone and joint in your foot is loading when it hits the ground.
How about arch support? That's part of it, I guess?
Yes, that's a big part.
And being flat-footed can be a problem, can't it? And aren't women more flat-footed?
Not necessarily. But there's a big relationship between flat-footedness and some injuries. Okay. Also, some people just have flat feet, and that's not a problem. So my job is not to fix something that's not broken.
Yeah, you can't create an arch. Yeah,
I only do this for people who have a problem with pain. So I see many people who come in and say they've been told they have flat feet, and I say, well, have you had any problems? Are you hurting?
Well, it's not a bad thing, but it's interesting for those of us with high arches to see people whose feet are just flat on the ground.
Yeah, and then vice versa is true. Some people have really high arches, and we have to give them a ton of support.
So that consultation is key to be able to come in and do that, and they can just call you guys and make an appointment to come in and have an evaluation to kind of know where they stand.
Yeah, so it's going to take about a 30-minute one-on-one session where we want to see how your feet are moving, watch you walk, watch you stand, and be able to do a true head-to-toe assessment for what the root of the problem is.
Can we go online to your website and know more about you that way?
Yes, so Limitless Therapy and Wellness, the website or the phone number is the easiest way to get a hold of us. We want to try to get you in as soon as possible.
But if we come in and want to just chat for 10 minutes and feel you out a little bit, is there a charge for that?
Really, we want to know that we're the right fit before you ever come in. So we take that time and do our due diligence on the phone call with you.
Okay.
And make sure that if we have to talk to you for an hour on the phone to make sure that we're the right fit, that's important. Awesome. We don't want to waste anyone's time.
Sure.
Since we have you here, are there any things that we can do at home to kind of help us, avoid some of these injuries, or at least take better care of our feet and our bodies?
Absolutely. So how informal can we get? Can we take your shoes off real quick, Jack?
I don't wear socks, so I'm not sure
wear
my
socks,
feet, but
we'll do it in the shoes then. So just stand here. First thing we want to do is have you stand just on your right, just on that leg. Work on your balance here.
That's tough.
And your foot needs to feel like a triangle. The heel goes over to the big toe and then across to the pinky toe. So find that triangle of support. That's your tripod of support.
Got the tripod of support.
Now keep that.
Is this going to take
Jack
long?
is my tripod of support.
Now close your eyes.
Okay.
We rely on our vision
Really
for balance.
difficult.
All right, open your eyes. I won't make you hold that too long. But that gives you an awareness of the fact that when we take away your vision, now your joints have to do more work.
Right.
I can
And so-
cheat. I do it in yoga all the time. We're like,
You've got to have that stability.
Well, that's fascinating.
Yeah, that's one way that we want to build that proprioceptive awareness and that movement control there. And then we want to do some strengthening on top of that.
But now women are so into fashion shoes, you know. You love shoes.
I do.
It's a thing with him. But again, they look better now, right?
Yes, so we have different orthotics based on different activities, but I will tell you, there are some women's shoes that we can't pull the sole out of and put a new orthotic in.
High heels and stuff.
Yeah, and that can be a barrier sometimes.
Where are you located?
We have a mobile option and then an in-person option. So we've got a downtown Greenville office, we have a Woodruff Road office, and then in some cases we go to our client's house or even their workplace.
That's exciting.
awesome. Great information.
that, sure.
Leave your Louboutins at home, Jack.
My Hoover Time.
Exactly.
Thank you so much. We appreciate it.